So the world adopted historically the Pact of the Future. We're at a critical juncture to attain the Sustainable Development Goals. I am excited about the inclusion of sexual and reproductive health and rights in the Pact of the Future.
I think the community has to come together, talk about accountability, talk about the data, talk about what's going on. Often we see creative ideas, new ideas, but coming one at a time. And the important thing is to be able to share those, surface those, be more transparent so that those can add to more than just the sum of their parts.
Our newborns are the future leaders for tomorrow, so they have to be saved through effective antibiotics that are actually making sure they do not die from preventable diseases. So the problem of AMR is really, really big, and it's affecting the gains we've already made for maternal health and newborn and child health, and in some cases even reversing those gains.
Climate change is also a maternal health issue. It's a reproductive health issue. It's a sexual reproductive health issue. It's here. And it's a crisis. We need to accept that and integrate programs that will better respond to this crisis.
The women and adolescent girls who are most likely to die in childbirth are those living in humanitarian crises. Now is the time to invest and learn how to effectively deliver sexual and reproductive health services in emergencies.
It's very encouraging again to hear a lot of important kind of conversations happening around financing, around quality, around the women themselves and their right to health services.
So financing for maternal health and child health is so crucial because regardless of which part of the world, funding is always not enough.
We have to look at the three delays. Delays at the community level, delays from the community to the health facility, and delays around the health facility.
In low and middle income countries, it's very important to focus on women, both as clinicians and as patients.
The main call to action is really about funding, commitments, policy, but also follow through. So the call to action is do what we say what we do, and reach the people who need it.
Let's put on our boots, fold our sleeve, and go to the field. And also, yes, we can change the policy, we can change the hospitals, everything. But if we are not involving the men, if we are not involving the traditional and religious leaders, we are going to continue losing women and children.
We need local production of antibiotics, we need health worker training and community engagement.
Health leaders and more have said these are the things that we need to do to achieve the ambitions of the 2030 agenda. And it now comes down to us to act upon it and also hold ourselves accountable, certainly hold others accountable, governments, multilateral institutions, donors, to deliver on that agenda and ensure that there is progress for all people and progress for the planet.
My main takeaway from UNGA 79 was, while we face the poly crisis that we are confronted with, that this is very doable if we come together as a partnership and stand with each other to fight the common fight and advance the agenda for women, children, and adolescents' health.